Good evening,
Greetings.
and how are you today?
I'm doing kind of well today.
Okay, who have we got here today? Excuse me.
Okay, my name is Samantha Greaves. I am 52 years old and I am a sickle cell warrior.
What type of sickle cell do you have?
I have sickle cell SC, HB disease with thalassemia.
Describe the first time you experienced a sickle cell crisis.
The first time I was like 4 years old, and the reason why I had the crisis was because I had an accident, a childhood accident, and that caused the sickle cell crisis. All I know is that it was very painful and I thought I was dying, and that's all I can really remember. I was actually 4 years old, and that was the time I was actually diagnosed with sickle cell, so it's the first time anybody knew in my family that I had sickle cell, and that is the day that my guinea pig structure, began in this UK, so yeah, I was 4 years old.
Does anyone else in your family have sickle cell?
Yeah, my younger sister has sickle cell also, and my brother and other sister carry the trait.
Which part of the body is most affected with you?
My joints and my chest. Oh yeah, and my head. I've had aneurysms and stuff as well.
What is your treatment plan?
Currently, as I said, I was being a guinea pig, so I've gone through lots of different treatment plans. But now I'm more, able to manage myself, and I use daily. I'm on tramadol. I use codigamol as well, and also iron, folic acid, and morphine, which they allow me to take home because they know that I'm not a drug addict and responsible. I can take the morphine and take it home and use it as and when I need it.
Is there a lack of awareness about sickle cell in the hospital? If so, how?
There is definitely a lack of awareness, especially in hospitals that don't have a sickle cell department, like specialist hospitals. I can explain how by one of my last, in 2015, I had to have an operation in my head for aneurysms at the well-known head hospital. Now they're very brilliant, with what they do, like with anything to do with the head, but they don't have a sickle cell department. So they weren't trying to listen to myself or my family when it came to us advising them on what to do before they put me under sedation for any form of operation. And because of their ignorance to what sickle cell is, although they fixed a problem in my head, they caused me the biggest sickle cell crisis I've ever had in my life. Then they overdosed me because they didn't know how to treat what they caused, and they were overdosing with drugs and more drugs and more drugs. And then I had to be rescued and transferred to a different hospital, to my normal hospital, where I had to be weaned off the drugs like a junkie, shaking and quivering off of these drugs, until I was able to respond normally. So we were an operation that would have taken somebody 3 days to go in, have the operation and come out. I ended up in hospital for 8 weeks, and that was because of the sickle cell crisis they caused, and then the overdose of medication they caused, and then the weaning off the drugs, and then the 3-month recovery period at home thereafter. So yes, there is a need for sickle cell awareness in hospitals, especially amongst the specialist hospitals.
What is your role for Sickle Cell Cause, and what does it involve?
Okay, I'm like a jack of all trades then. I'm in every department. I'm the group coordinator, so I know what's going on in every department. My role is to set up the meetings, to make sure that we have volunteers, to make sure that everything happens. So I can actually tell you what Sickle Cell Cause does, if that's what you're asking. Sickle Cell Cause, the word cause is an acronym of the services that we supply, which is care, and that's to the sickle cell patient and their families and siblings and so forth. Advocacy, So at the moment, we're actually fighting to keep our centre, which we've had since 1989, which was built for our purpose, and they're trying to take our centre away and give it to another health community, even though there's more sickle cell patients and more awareness needed in the community. So that's one of the advocacy campaigns that we're running now. Apart from that, trying to get cell separator machines in our hospital. And then there's unity. We work as a unit, you know, so there's complete unity in our group. So that's, and then S is obviously support. We support each other. And empathy. What you don't find in other groups is empathy. And other work walks of life, when it comes to sickle cell, there's a lack of empathy, you know, so we're very strong on that because we're all affected.
What does the George Marsh Centre mean to you, and why should it be saved?
Well, it means a lot to me personally. I mean, I was a patient of Dr. George Marsh. He was like my childhood consultant. I mean, as I've gotten older, I do realise that yes, we were guinea pigs. At the time, I knew that there was using us for a lot of different experimental drugs and so forth, but we understood that it was needed for them to get the correct medication for the care of sickle cell. But one of the promises was that we would have a centre. You know, even though he was like, I've done a lot of research, he was a caring physician, you know, and he did help us, but he did promise us a centre, you know, because he knew there was a lack of support for sickle cell and thalassemia patients in the community. And he campaigned to have that centre built, and it was built from the first brick up. It was built and created for sickle cell and thalassemia patients, and it was the first centre in the UK and Europe for sickle cell and thalassemia patients, and it's still standing today. It's still a functional centre, you know. So to me, it means a lot because it was built. It's like our pain is in that centre, you know. Sickle cell patients of my years, my age, actually were used, our bodies were used, and that was our gift, you know, to have our hub, you know. So to me, it means a lot. You know.
How does sickle cell affect your day-to-day life and daily?
I can't make plans. I mean, I do make plans, but I just try to ask everybody that knows me to understand that even though I'm making an arrangement with you, don't, you know, expect that I may not be able to make it, you know, because you don't know, with sickle cell, you don't know what's going to happen, you know, the next day or the next hour. I'm in constant pain. I take medication. As I've gotten older, I mean, actually about 20 years ago, I managed to wean myself off of most of the prescription drugs that I was on, and I was like a lot healthier, you know, than I was before, you know, and I used a lot of nutrition and stuff, and I think that was very helpful towards me. But as I'm getting older, I'm starting to find that I'm having more issues, you know, and sickle cell doesn't help, you know, with it. So for me, living with sickle cell daily, every day is different.
Just stop there for us a minute.